You are welcome to Soul Sisters. It is on a Wednesday, and that's when you get to listen to Soul Sisters on Smooth 98.1 every Wednesday from 11 till 11:50, because that's when we have Women Crush Wednesday, right? So it's only appropriate that we discuss issues relating to the women and educate you as well. That's for the women and the men. So we do this every Wednesday, 11 till 11:50 on Smooth 98.1, where we love music. We love life in its entirety, and we love the women. We love the soul sisters. We appreciate the soul brothers, and we say thank you for always listening. So right now, what you can do is make sure you do not even think about changing the dial for the next 1 hour and even beyond. If you want to be a part of the discussion, you can send your messages on WhatsApp later on, or you can call 01448 9981. You can also take a stroll to our YouTube channel, which is youtube.com/smooth 981 FM Lagos, and make sure that you are subscribed so that you can see anything going on in the studio whenever we're streaming live. Or you can also save the stream and watch at your convenience or share with your family and friends. That said, if you have seen the flyer and you're following us across all social media platforms, or you have been listening before now, then you will know that we are set to talk about dealing with body changes in pregnancy. What happens when before pregnancy, a woman is fair, and in pregnancy, she becomes really dark? Before pregnancy, she has a slim nose, and in pregnancy, she is breathing for four. And then what happens when her hair is so thick and luxurious, and the next minute it's so thin? So all of those things, what happens during pregnancy, is what we'll be talking about from now till 11:50. And to do that, I have someone who has gone through the process herself. So she's not just a medical doctor, she's a mom, she's a telehealth expert, she is an advocate of health and wellness, and occasionally she puts out videos and content on her social media page to educate on different subject matters. And she is Dr. O. Well, she is Dr. Olufemi Idowu at Check with Dr. O. She's joining me virtually on Zoom. Good morning.
Good morning, Sean. How are you doing today?
I am well, thank you. Thank you for being my guest this morning.
Thanks for having me.
So let's dive right into it. First of all, will pregnancy really humble you? That's where I want to start. Because that hashtag, if you click on that hashtag, pregnancy will humble you, my word, you will see tons of videos. But is this, what's your take on it? Is it something that every woman goes through, or it just depends on who you are?
So, Sean, the truth is, coming from a personal point of view and from a doctor's point of view, I can tell you for sure that no matter who you are, no matter how old you are, no matter how many times you've done it before, pregnancy will humble you. So just be prepared. Yeah, pregnancy will humble you.
I mean, when you started with no matter who you are, I knew where we were going already. It will. But what are the humbling? What are the things that constitute that humbling? Is it that I know mentally, if you go online, you will see search results that tell you the body changes to expect. So mentally, it means you should be prepared. But what still happens that when you have the baby in you, everything just changes?
Yes, the truth is, you can read all the books you want, watch all the videos you want, but you can never truly be prepared, right? Sometimes even other people's experiences that you read is totally different from what you expect. Even for women, what you experience during your first pregnancy is totally different from your next pregnancy, right? So even for someone who's done it before, it's still unpredictable, right? And for the fact that some of these changes you have no control over, and a lot of them you can't even prevent. So it sort of gives you the feeling of, I really, really, like, it's for a good cause, but you're like, can we not do this? Why do I really have to go through this? So yeah, women go through a lot. We actually try.
I totally understand that feeling. In fact, I remember the first time I sat down to read what pregnancy does to you, and also seeing people around me. My sister is always the classic example. I remember one time that we made jollof rice and she sat down to eat the whole pot. The whole pot. We
Oh.
still make fun of her because the next day the baby came out. So we always tell her that it was because she ate everything. That was why the baby ran out of the womb. I can't take it anymore. Because you're wondering why. I mean, things that you never expected. Maybe
Yeah.
that's when we will say thank you, technology, for having baby pods. Soon enough, we're going to have baby pods so that people don't go through that.
Yeah.
But
Yeah.
now let's start to have an overview of the changes that happen in pregnancy. I mean, the first trimester. Let's get started with that. What are the things you were expecting to see?
Okay. So, like I said earlier, every pregnant woman's journey is different. And even for the same woman, with each pregnancy, the journey is always different, right? I always tell my patients, pregnancy is a journey, right? And just sit back, relax, and enjoy the journey, because we know, give or take, it's going to take about 40 weeks, right? Or 9 months, the way people see it, right? And the journey starts from, if you are a woman that has regular periods, the journey is going to start from when you miss your period. That's usually the time most women know that they are pregnant. So it's like, okay, my period is missing. And then you have to do a pregnancy test, and then it's positive, and you realize you are pregnant. And that is where the journey, starting from the first trimester, begins. Now, for most women, even before they miss the period, right, they're already undergoing some changes, but some of them don't immediately notice these changes, especially because sometimes the changes are similar to the kind of changes you go through in your menstrual cycle. So, for example, one of them is tenderness of the breast or swollen breast, right? Now, I don't know if you can hear me.
Yes, I can hear you clearly.
Okay, yeah. So tenderness of the breast or swollen breast, right? Women start to feel, one of the first changes, women start to feel that their breast is sore. It feels a bit painful when you touch it, especially around the nipple area. And for some women, this might be nothing because it's a regular symptom they experience during their periods anyway, so they don't even see this as pregnancy. But for some women, it's not. So they'll be like, okay, what's really going on here, right? Of course, maybe after that, then they notice that their period is not coming, and then it prompts them to do a pregnancy test, right? Now, the next thing that some women will notice is that they start to feel some excess salivation, right? So you're producing more saliva than usual, right? And what happens is some women are able to, control this. For some, it's mild. For some, it's really major, where as pregnancy progresses, they have to spit a lot, right? That's why sometimes you see pregnant women spitting, right? Another thing that usually happens early in the first trimester, which a lot of women have difficulty dealing with, is morning sickness, okay? I don't know why they call that the morning sickness, because it can happen at any time of the day, like, and it's usually not even in the morning, right? But yeah, someone decided to call it morning sickness, and that's what we all know it by. So it's like nausea and vomiting that you feel in pregnancy, right? And that's usually the worst in the first trimester. However, for most women, it subsides later in pregnancy. By second trimester, you feel okay, right? You don't have too much nausea or vomiting. Another weird symptom that you have in the first trimester is that you start to get this kind of metallic taste in your mouth. And this happened to me. It was so weird. Like, my mouth just tasted funny, right? And it's called dysgeusia. So you just have this metallic taste, and everything you eat tastes funny. Even when there's no food in your mouth, it's just tasting funny, and nothing really makes it go away, right? So that's one of the things you have to deal with when you're pregnant in your first trimester. Another thing that we popularly see in Nigerian movies, apart from that nausea and vomiting that you see, is fatigue. For some reason, you're just always tired. Like, you just want to sleep. You just want to always be resting. Trust me, there's nothing wrong with you. You're not lazy. You're not weird. It's just the hormones. By the way, all these changes that I'm going to be talking about today are totally caused by hormonal changes. Every single one of them is caused by hormonal changes, right? Because when you get pregnant, your body is preparing for your pregnancy, preparing to carry a baby. So different things are happening, right? And that's what results in the changes and the symptoms that we experience, right? Now, another popular one that women normally experience in the first trimester is heartburn, right? Again, this is hormonal changes. So the hormones in the body, the pregnancy hormones, they cause everywhere to relax. So the ligaments, the muscles, and also it causes, so between your stomach and your esophagus. So the esophagus is what connects the mouth to your stomach, right? There's a valve that opens and closes, right? That lets food pass through. Now, when the pregnancy hormones cause relaxation, the valve doesn't close properly, right? It's a bit loose. So acid from the stomach now flows back into your esophagus, and that's where you get that burning sensation in your chest that we know as heartburn. And then again, this relaxation also causes another unpleasant symptom, right? And this one is known as constipation. So yeah, even if you've not been pregnant before, at one point or the other, you've probably had constipation, right? It's just that in pregnancy, your constipation is mainly caused by those hormones that relax everywhere in your body, right? Including the muscles, the ligaments, like I said, and digestive tract. So food is now passing slowly through your digestive tract, and inevitably you get constipated, right? Because when food takes a while to pass through, right, more water is absorbed, right, from the feces, and then it becomes harder to push out, right? So these are some of the few things that you experience in first trimester. Trust me, there are a whole lot more. But
some of the few things.
yes,
Only the first 3 months.
Only the first 3 months.
Oh, we'll be right back to hear more and, of course, to tell you how to deal with it. If you're listening for the first time, we are talking about dealing with body changes in pregnancy. Stay with us. Things like these are enough to say, I don't want to have a baby.
I swear down, things like
just
this
the first trimester.
Just the first trimester. But I can tell you that the first trimester is like the worst, right? The first trimester is the worst. I mean, after the first, if you can scale through the first trimester, the rest, are good.
My God, women are superhumans.
Yeah.
What? I mean, the mere fact that you have to have another entity growing inside your tummy is scary.
Somebody else occupying space, especially when they start to move, you're just doing your work and somebody just kicks you and you're like, and people around you are like, what's it? And you're like, never mind.
And things like this actually make me wonder how the animals cope. Like how do this things cope? I imagine that primates and mammals probably experience, at least I can imagine that a gorilla, an orangutan, all those people in that family, I said people, all those animals in that family experience this. How do they feel? How do they communicate?
Well, I don't know. I honestly cannot imagine how they cope with it, but I guess they just have their instincts that guide them on how to behave, how to manage things. You know how even you notice just from watching all this Discovery, National Geographic, you can see that they have a natural motherly instinct. They protect their younger ones and all that. So it's probably the same in pregnancy. Instinctively, they just know how to manage it, what to do, that kind of thing.
And to think that an elephant carries a baby for close to 2 years. Hey! My God. I know having babies is it's a risky thing, but
it is
inevitable risk.
I mean, even these symptoms we're talking about, right, is not even the risk. There are other things, when you can have hypertension in pregnancy, you can have diabetes that could lead to complications, or worse still, during childbirth, even in Nigeria and outside of Nigeria, a lot of women die during childbirth, right? Yeah. So I normally say pregnancy is, when you're pregnant, there's a thin line between life and death, right? So when you go through the pregnancy journey and you come out alive, you really need to thank God, because so many women never come out alive. And that's the part people don't get.
And the funny thing, women keep doing this thing over and over again.
I'm like telling you.
One minute, they say, oh, I call the stress and pain. Another minute, they are having a baby. Like, why?
Like, why are you doing this to yourself, right?
Shout to my ovaries.
Yeah. So I think, after you push out the baby, you sort of forget. You develop some sort of amnesia.
Yeah, I will not forget that one, though. Come back. Love music and love life. We are Smooth 98.1. You're listening to Soul Sisters, 22nd of November, 2023. And it's 60 minutes past 11 o'clock. We're talking about dealing with body changes in pregnancy. My guest is Dr. Olufemi Idowu, also known as Dr. O. And it's been interesting. If you have been watching on YouTube, you will hear the conversation we've been having. Number one of the things I said is if women go through this, I'm sure, even though it might not be exact, but the same symptoms to an extent, the same fatigue, tiredness that animals go through, I don't know how they go through it and with no avenue to express themselves. That is one part. The second part is the fact that women go through this multiple times. I mean, the first pregnancy, you go through the nausea, you go through the fatigue, the heartburn, you have that baby, and you still want to do this all over again? Why? Why? Just do it once and go. But then it's part of the beauty. So we've had an overview of what happens in the first trimester. Let's move to the second trimester. Hopefully it is not as, I don't know, complicated like this one.
Okay, so actually in the second trimester, for me, I'll say, for me personally, and for most other women, right, they normally say second trimester is the best trimester ever, right? Why? Because it's the time you actually forget that you're pregnant, right? But then everyone can see you're pregnant, right? So in first trimester, you're basically suffering and smiling. You're going through all that, but nobody can see you're pregnant. So you don't get all the pity of, oh, sorry, yeah, baby, come and sit down on the chair and all that. So in second trimester, when most of those symptoms have subsided, right? So you're in your A game, like literally you forget you're pregnant, right? Until maybe you're trying to wear your clothes and your trousers don't fit, right? So, but people around you are like, oh, there's a long queue and it's like, oh, Coco, go ahead, you're pregnant. Or there's no seats. Someone gets up for you and say, oh, you're pregnant, come and sit down. And in your mind, they're like, I'm not even going through anything. But anyway, I think I'll take it, right? So second trimester is usually much easier. If you've scaled through the first trimester, congratulations. It gets much easier from here, right? So in the second trimester, one of the changes that happen is still with the breasts, right? So those breasts that were tender and sore, I'm not as tender and sore anymore, although some women may still experience tenderness. But guess what? Now the breasts are getting bigger, so they look nicer, right? So you might notice that you're getting 1 or 2 cup sizes up, so you might need to change your bra, right? Most pregnant women, you always experience having to change your bra. If not, whatever bra you're using pre-pregnancy is going to be uncomfortable. So get ready to change your bras. Get something comfortable for you, right? Now, another thing that is going to be more obvious is the fact that your belly starts to be more obvious. So remember I said people start to see you're pregnant. That's because your belly is growing. It's getting bigger, right? And your baby is growing. That's why your belly is growing. And now, one thing that happens for some women, especially if it's your first time getting pregnant, right, is as the baby is growing, of course, the baby is getting heavier. So you start to feel some lower abdominal pain. Now, this is the point where some women start to get worried, like, okay, what's happening? Am I having a miscarriage? Is everything okay with the pregnancy? This is totally normal. Like I said, especially if it's your first pregnancy, it's what we call the round ligament pain, right? So remember that your baby is sitting in the womb, what we call the uterus, and that womb is sitting just right there in the pelvis and is supported by 2 rope-like things called ligaments on each side, right? So as your baby grows, it's like putting more weight, right, on these ligaments that are supporting. So just because ligaments are stretching, that's why you start to feel a bit of pain, right? And this pain usually just lasts for maybe a few days, few weeks, right? But taking pain relievers helps with the pain. So pain relievers are good. So nothing is wrong with you. It's just your baby is growing and your body is responding to the changes that way, right? Now, another thing that happens in the second trimester is skin changes, right? So again, because of the hormonal changes, right, there is an increase in production of melanin, a pigment called melanin in the body. You know, what makes our skin complexion, what determines our skin color is actually that melanin pigment. So the more melanin pigment you have, the darker your skin is, the less you have, the lighter your skin is, you know. So people that are white, they don't have as much melanin pigment, or people that are fair in complexion, that's why they have that complexion that they do. But in pregnancy, when this pigment increases, you now start to get darker, right? For some people, they even experience something called melasma, mask of pregnancy, where they have brown patches, maybe on their face, on their neck, on their arms, or really any part of your body that is exposed to the sun, right? This is totally normal. And the good thing is, over time after pregnancy, it fades, right? Now, this increased melanin pigments will also cause, if you notice, pregnant women, especially in all those pregnancy photo shoots, when they're showing off their baby bump, you see this thick vertical black line that is running from the just below the chest all the way down. It's called linea nigra. It's caused by that increased pigmentation, right? Now, another thing that you might experience in the first trimester, though most people maybe experience this in third trimester, is stretch marks, especially on your belly, right? Because just like the name implies, stretch marks comes because of the stretching of the skin. And of course, imagine your small belly and then a huge baby, placenta, everything inside. It now expands, right? So the way the skin responds is by developing stretch marks, right? Now, some women, because your tendency to have stretch marks varies with your genetics, right? Varies with your genetic makeup, how your skin reacts to these changes. So for some women, they may be lucky, they may not develop stretch marks. For others, they're not so lucky, they easily develop stretch marks, right? So not every woman will have stretch marks in pregnancy, but a lot of women do. I personally, in my first trimester, I avoided it the whole time, and I was really feeling like a G, like, oh, I really did. Sorry, not first trimester, my first pregnancy. You will not believe, Sheil, 3 days for me to pop the baby, as in 3 days before I gave birth, I just saw stretch marks. I'm like,
where did you come from?
From nowhere. Like, I could totally have done without those stretch marks. Maybe if I pushed it out earlier, but they just started to come. And the thing about stretch marks is they do fade over time, but sometimes they never completely disappear. So just take it as your pregnancy scars. You continue to see them, they will be marketing all these stretch mark, this stretch mark cream, blah, blah, blah. Those things never really work, right? Stretch marks will fade on their own over time, but it may never completely disappear. So those are some of the changes that we have to deal with, right? Now, another one is this, and earlier during the show when you were introducing, you mentioned something about pregnant women with bigger noses and all that.
Yep.
Right?
Yep.
Usually starts in the second trimester. Now, I'm sure a lot of women are wondering that why does my nose have to get big? Like you said, breathing for 4. Is it because I'm breathing for 4? No, actually, it's not because you're breathing for 4. So what really happens is, like I said, every single change that I've been talking about since is just because of your hormones that are changing, right? And the 2 major hormones that are responsible for these changes are estrogen and progesterone, right? So they cause an increase in blood flow to the nose, right? And when that happens, it results in a swelling in the nose tissue. And that's what you see as pregnancy nose, right? The good thing about it is this swelling or this change is not permanent, right? After pregnancy, your nose goes back to normal. But for some women, it can be really horrible. In fact, like someone like me, if I was pregnant, right, the first thing that would probably give me away is nose, right? Like for women that have that pregnancy nose. Luckily, I never had it in my pregnancy, right? Just by the way, there's nothing you can do to prevent it. You can't drink any herbs or eat any particular food that is going to prevent it, right? But I think it's also due to genetic makeup. Like I said, people's bodies react differently. So just because one person is experiencing it does not mean it will happen to you too. Because my 2 pregnancies, I never experienced it, and thankfully not, right? Because it just changes the way you look and all that. So yeah, these are some of the changes that you can experience or you can expect to experience in the second trimester. But like I said, not every woman would experience all of these changes. It varies for different women.
Thank you so much for that reassuring one. I imagine that a woman who is listening is waiting for that part that not everybody has to experience this, and that just makes it, well, less scary. Yeah, because when you listen to all this, especially when you see it as well, you are filled with that sense of, oh my God, this is what I'll look like. This is what I will walk like. I remember somebody calling my sister a penguin when she was pregnant because of the way, and she had this really big belly. The baby came out at 4.2 kg, so you can imagine how big that belly was, and she was waddling like, oh my God, this is what happens. But yes, like you rightly said, not everybody will go through that. We'll come back to the trimester right after this. You're listening to Soul Sisters on Smooth 98.1. It'll be rolling like God. Even to sit down, oh, that is the worst. Like they
Yes.
have to sit with legs apart. Like,
Yeah.
no, I don't want
I
that.
mean, when you get pregnant, because your belly is growing, just
Mm.
imagine that, like how I used to see some videos on social media where some men want to simulate pregnancy and then they will now stick watermelon to their belly. That doesn't even cut it, right?
It
But even
doesn't.
that is difficult, right? Because your tummy is getting bigger, your baby is growing, your baby is getting heavier, right? So
Yeah.
something is just occupying space in front of you. I mean, you can't even lie on your belly anymore, right? You can't, when you want to bend down to pick something, you cannot just bend and pick it. You have to gently just, it can be annoying. Like all things I can't just bend forward. No, that can't happen anymore. So yeah, women are trying.
Yeah, they are. That feeling of helplessness, I can only imagine it, where now you need help with some things.
Yeah.
You can't wash well. It is well. Still, tweets all over again. Many times. I imagine those that had about 8 babies, 9 babies.
Ah, I honestly don't know how they did it, right? Even though I think, right, as much as you don't have the same symptoms in subsequent pregnancies, but it becomes easier, right? Because my now, for some women, it may not be, right? And of course, the older you get, right, the older you are when you get pregnant, the more likely you have to have symptoms, or the more likely that it is to be a more difficult pregnancy, right? That's why it's better to do these things when you're younger if you can, right? But I feel like in subsequent pregnancies, it sort of gets easier just because you've done it before, and your body also has already gone through some of these changes. So it's not like fresh, like that round ligament pain. In
Mm,
subsequent pregnancies, it may not be as bad, or you might not even get it at all, right?
mm,
But for most people that are getting pregnant for the first time, they do feel it, right? So it sort of gets easier.
mm. Thank you. You're listening to Soul Sisters on Smooth 98.1. And if I were you, I would join the YouTube stream because more and more gems are dropping on YouTube. The channel you're searching for is Smooth 91 FM Lagos on YouTube. Smooth 91 FM on Lagos, Smooth 91 FM Lagos. Now we have our WhatsApp line active. That is 0809 444 0981. Again, 0809 444 0981. And if you are worried that somebody who you would like to listen to this topic or discussion is not in Lagos or in Nigeria or even in Africa, you can simply tell them to go stream via our website. Our website is www.smooth91.fm. Again, www.smooth91.fm. My guest has been Dr. Olufemi Idowu, and we have been talking about the body changes that happen in pregnancy. Again, the caveat is not everybody will go through all these changes in the respective trimesters. We've talked about the first trimester, which seems to be hardest. Then it gets easier in the second trimester. And then let's talk about what happens in the last 3 months.
Okay, so last 3 months, we're finally getting to the end of the journey, right? This is when you're already doing your baby shopping. Everyone can see you're pregnant. Everyone is expecting you to pop at any time, right? And I think it's the part where you feel like, can this baby come out already? Like, you have been here since, can you just come out? So it's the time that feels the longest in pregnancy, right? Because it seems like it's just going on and on and on forever. Again, this time is still better than the first trimester, not as good as the second trimester when you forgot you are pregnant. Because right now, in the third trimester, you will remember that you are pregnant. First of all, your baby is getting bigger, right? So the weight of your baby, or the weight that you're carrying, is heavier, right? Now, one thing that most women in the third trimester complain about is back pain, low back pain, right? Because of the pressure of the weight of the baby.
Oh,
And the
yeah.
fact that those hormones are relaxing your muscles, your ligaments. So the bones in your back are not even able to cope with it as much as you would if you were not pregnant. So you start to feel low back pain, especially when you stand for too long or you sit in a bad posture, right? Sit with a bad posture. So it's important that when you are pregnant, especially in third trimester, late third trimester, try not to stand for too long, right? To help with the back pain. Now, another thing that women experience in third trimester is something called hemorrhoids, right? So because of the pressure that the baby is putting on your pelvis, right? And the constipation you would have been going through over time because of the hormonal changes, then you can start to have hemorrhoids, right? And for some women, after pregnancy, this goes away, right? For others, well, it may never really disappear. It may just, be there permanently. But to prevent this from happening, right, you just have to eat food that is higher in fiber, so more fruits, more vegetables, drink more water, so that you don't have chronic constipation that could lead to those hemorrhoids, right? Now, another thing that women could experience in third trimester is something that we call Braxton Hicks contractions or false
What?
contractions. Braxton Hicks. That's
Okay.
Braston. It's just a name for it. It's basically false contractions, right? So this is
Oh.
your body preparing for labor, your body preparing to push out your baby, right? So now these contractions are not real. It just feels like a tightness in your tummy. So normally when you have contractions, when you look at your baby bump, it looks tighter. It looks like a round hard ball, right? So you can see this with Braxton Hicks. Now, but the difference between this and real contractions is real contractions, when they start, right, they occur at frequent intervals, right? Braxton Hicks doesn't occur at frequent intervals. It just occurs randomly, right? And usually it stops with movement. So if you just change your position, it will stop. But a real contraction, if you like roll around, it's still good to be there, right? And with real contractions, the intensity would increase with each contraction. So first of all, they come at regular intervals. So it might start maybe every 5 minutes or every 10 minutes, and then it gets more frequent. So from 10 minutes or 5 minutes, then we go down to every 4 minutes, and every 3 minutes, till it becomes more and more frequent. And with that increase in frequency, it becomes more and more painful. So for those of you who are wondering what a contraction feels like, if you've never been pregnant, just imagine your menstrual cramps, right? You know how we always say, menstrual cramps is so bad, I can't breathe. Yeah, right. Wait until you see labor pain.
That sounds like you're scaring them in advance.
No, I'm not trying to scare you, but seriously, labor pain is like menstrual cramp pro max. That's how it feels. Menstrual cramp that is just getting worse with time, right? So that is with contractions, the intensity gets worse, right? It never really stops. And remember, the intervals are regular, but with Braxton Hicks, it's not regular, it's painless. These are painless contractions. And when you move, they tend to stop, right? And it just happens randomly. It can happen at any time, right? So, of course, in the third trimester, another thing that you feel is movement of your baby. You would have started feeling this by early second trimester, right? But it's more pronounced in the third trimester, such that doctors might ask you to always monitor your baby's movements. If you notice that your baby has not moved in a while, right, then you need to visit your doctor and make sure that the baby is okay and everything like that. So in third trimester, there are not too many things. Another thing some women might experience is maybe swollen legs, right? Because of the changes in your circulatory system and fluid retention, then you start to get fluid accumulation in your legs, and your legs start to get swollen. That might happen. Not every woman, like I said, would experience this, but some women do experience this, and it normally happens later in the third trimester for most women, right? So, but most of the changes they are dealing with are changes that were already there that are either coming back or getting worse. Another thing is frequent urination, because the baby is sitting in your pelvis, so there's more pressure on your pelvis. So there's more pressure on the baby sitting in your pelvis, so there's more pressure on your bladder because your bladder is still right there in your pelvis. So you see that every time you're going to the toilet to pee, because your bladder capacity is reduced, it can't retain as much pee as it used to. So you have to go empty it more often, right? And then another one is sometimes you feel bloated, right? I remember in my third trimester, some people say, they were eating a lot. In my own case, I couldn't eat because I was always bloated. I always used to get full fast. I would just eat 3-4 spoons of food and I'm already full, right? It's also because of the same thing, like your tummy is expanding so much that it's pushing on your abdominal organs, right? So you're not able to eat as much, and then sometimes you feel bloated. So yeah, these are some of the changes. Like I said, there are so many changes, but these are just some of them that you can expect in the third trimester.
Thank you. Now, I'd like to take you back to some of the changes we're yet to mention, which is a worrisome thing for some people, and I think I have seen conversations around it. Number one, let's talk about vision changes. There are people who complain of blurriness, they complain of short-sightedness.
Yes.
What happens?
So again, this also has to do with the hormonal changes that happen in your
This one
body
once again.
and the changes in your circulatory system and all that. It also tends to affect vision for some women, right? Like I remember it also happened, like my mom, after having maybe my brother or something, she actually started to use glasses, right? So sometimes pregnant women could experience blurry vision as a result of the pregnancy, and it all boils down to hormonal changes, right? But again, the good thing is not every pregnant woman will experience this. So when you are listening to this, don't feel like, oh my God, I'm totally going to transform to a new person in pregnancy. No, you might go to pregnancy and only experience one or two of these symptoms. Good for you. Everyone's body responds differently to the changes that happen, right, in pregnancy.
And the last one will be the memory loss. Is it still due to the hormones? There are people who temporarily, they just have that memory issues.
Yes, yes, yes. So again, this one is not very common, right? And yes, it is also due to hormonal changes, right, that affects the brain, right? Some women may say, oh, I can't remember something, or you might keep something here and forget that that was where you kept it and all that. The good thing is that after pregnancy, all these symptoms disappear, right? Once you have pushed out your baby, within a few days, within a few weeks, everything starts to come back, right? So if you're worried that, oh, I'm experiencing memory loss, or I can't remember something, it's okay. Once you've given birth to your baby, everything is going to come back to normal in a matter of time. Usually within that postpartum period. So postpartum is 6 weeks, right? This first 6 weeks after you've given birth is your postpartum, your preparing period. So all those changes will start to revert within that time. And after 6 weeks, for most women, you're back to normal. For some others, it might take a little longer, but eventually you'll be back to normal. So you don't have to worry about it.
Okay, thank you. Now, about dealing with the changes and adjusting, maybe mentally, psychologically, and every otherly. Food cravings. Is there anything that you can do to deal with food cravings? Because I have seen, let me even give you a recent example.
Yeah.
A friend of mine, long story cut short, she cooks her own food, brings her own food, and she's unable to eat her own food. And she wants mine or the one of the people around her. And I'm thinking, what is this? This still happened last week. Like, what is going on? How do you cook your own food, package everything, and you don't want your food suddenly? You want mine.
Yeah, yeah. So actually those food cravings, again, they are down to hormonal changes, right? So some women will have food cravings while some women will have food aversion. That is things that you usually love to eat before you no longer want to eat it. You can't stand the smell, you can't stand the taste, right? A lot of women do say they experience food cravings. I can't really remember experiencing any food cravings. Funny enough, as much as there's a lot of hype about it, I never really experienced it in my first two pregnancies. But one way to deal with it is I always tell pregnant women, there's this myth, eat for two, right? It's not true. You're not supposed to eat for two, because that's what leads to the whole excessive weight gain in pregnancy that you're unable to shed after you're pregnant, right? So whatever you do, yes, these cravings, because it's a craving, you want to satisfy it, right? It's good. I mean, if you have the means, if you have the capacity, by all means satisfy the cravings, but don't overindulge yourself. Don't go binge eating. Okay, I want to eat shawarma, one or half, but not three, four, right? Because you are eating for two. So yeah, by all means, satisfy the cravings, if you can, but moderate portions. Don't eat too much, right? You still need to eat within the healthy limits as much as possible.
Okay, and
And
if you're
also, I think women that are with pregnant women also have to be understanding, right? Like you said, your friend, you understand that it's the hormones. She has no control over that. So just offer your food. Be nice.
what about the ones that wake up their husband in the middle of the night to go and get a particular suya from a T junction?
Yes, yes. The husband has to be understanding. I
Ah,
mean, you're not pregnant, so that's the best you can do. This is the least you can do. Get up and go get the suya.
that's not even the hardest part. I was reading some married men's experience about how, yes, they understand that you're going through these cravings. And when they bring the food back, guess what? They say, I don't want again.
Yeah, yes. That can happen too, because craving is just something that is temporary. It doesn't last forever. Maybe by the time they come back, they're craving something else. So you go get something else, right? It's only for a few weeks. 40 weeks, 42 weeks max. And you're done.
Wow. Well, to all the pregnant women who are dealing with this new adjustment in their life, our thought and our warmth goes out to you. And for the men, please be more understanding. Yeah, there is a lot going on within her. A whole human is in there. So please be very much understanding. We'll be back to talk more about how you can adjust to this stage as the man and also as the woman right after this. You're listening to Soul Sisters on Smooth 98.1. So when we come back, we give an overview of some of the things that the woman can do. I mean, generally, I mean, if she's having, for instance, morning sickness, fatigue, any other thing, what can she do to just be okay? And then in the case of extremities, I mean, what would be the things that will make a woman know this is not normal? Just some. And finally, your recommendations?
Yeah.
Yeah.
Sure.
This is a man's world.
But I think justice for that your colleague, or you guys should be ready to surrender your food at any time.
We have given up. We have given up. Like we already it's so funny. Like, how do you cook your own food and you don't want to eat your own food? And guess what? These foods are usually sumptuous and delicious, chicken and all the stuff.
Yeah.
God.
Yeah, you just have you just don't want some things then. Sometimes you find even things that you really love, like things that you really love before pregnancy. When you're pregnant, you just can't stand it. You don't want to eat it, right? And then some people have some weird cravings, like pregnant women could have weird cravings. Like there's something that we call pica, where you are craving weird things like eating sand or eating ice and things like that. Yeah. Again, this comes with the hormonal changes, right? They can't control it. It's not their fault, but they just have to.
It's not.
Have to deal with it.
Thank you. Let's come back. Love music, love life, love the women and the men, and you're welcome. If you are joining us for the first time, you have missed out on 43 good minutes of beautiful, educative conversation on the changes, the amazing and awesome changes that go on within a woman when she's pregnant. And it is nothing short of miraculous because so much goes on. I remember seeing a woman who detailed a story and she had pregnancy-induced vitiligo. It was scary. I mean, how do you go from not having normal pigmentation to going to something that starts as a little discoloration and then getting into full-blown vitiligo? So many things happen to her when she's pregnant. So be a little bit more understanding. Now, Oluwaseun on WhatsApp says, shout out to our guest. It is your world versus the men's world. It isn't easy though, but I think women use these things to get back at men most times. Why would someone send me suya at midnight only for me to come back and say she ain't interested in it again? It's not her, it's the hormones, it's the baby.
Exactly.
Yeah.
Exactly. It's the hormones.
But
I think men should always remember that it's the hormones. It's not your wife. She's not trying to be mean. It's the hormones.
All right, now, so let's come back to telling the woman how she can just adjust to these things, or maybe if there are ways she can cope, because you said there are some things that you can't do anything about, but how can you cope?
Okay, so for every woman, the way they cope is going to be different, right? I mean, different women have to develop coping mechanisms, right, for how they want to deal with these changes, right? So starting from the first trimester, right, when you are experiencing, say, nausea and vomiting, now that one is very difficult to deal with sometimes, because at the first trimester, every other person in the world that is not pregnant, right, or that is maybe later in pregnancy, there are drugs that you can prescribe that can help stop the nausea and vomiting, right? But for pregnant women in the first trimester, we're usually very careful with prescribing drugs because not every drug are suitable for first trimester pregnancy. So there's very, very limited amount of drugs you can prescribe to stop the nausea and vomiting. So a lot of times you just have to deal with it, right? Except when it gets to really extreme cases, and then you now look at benefits outweighing the risk and maybe certain drugs or injections that we can prescribe at that time. But for the most part, morning sickness is something that you're going to have to learn to deal with. And so how do people deal with this? Best way is, one, to prevent it. So avoid any smells that trigger the nausea. So when you're pregnant, don't be cooking any food that has any strong smells. When you're around people that are cooking serious, just excuse yourself. Or when you're around people that are eating strong smelling foods, excuse yourself if possible. Perfumes are another thing that can trigger this nausea and vomiting, right? Strong perfumes, especially. You'll be wondering that, what's wrong with my perfume? It smells good. Yeah, it smells good, but it's triggering my nausea. So please, can you tone it down a bit, right? Some of the spouses have to deal with this, right? So you might find that some women have had to stop using perfumes during pregnancy, right? Or switch to ones that are mild smelling or odorless. They are fragrance-free, like roll-ons and deodorants that you can use, right? So that you don't trigger your nausea and your vomiting. Then we find that eating smaller portions of food at regular intervals help, rather than eating a whole huge portion of a meal that can most likely trigger your nausea. So you're going to throw it up anyway. Just eat smaller portions at regular intervals and you'll be able to keep it down more. Then take regular sips of fluids. That also helps, right? It helps to not only keep you hydrated, but prevents you from vomiting repeatedly over and over again, right? And another thing is oily foods. Oily foods, they tend to trigger nausea than foods that are not as oily. So if you know you're going through morning sickness, you might want to avoid oily foods, right? Some other natural or home remedies. Some people, they find that taking peppermint helps to reduce the nausea. So tom, any mint sweets, just lick it. It helps to reduce the nausea. When I was pregnant in my first trimester and I had to go to work and attend to patients, so just so that I'll not end up throwing up on the patients, I'm just either chewing mint gum or taking mint sweet just to suppress that feeling of nausea. It also helps sometimes with excess salivation, right? When you are chewing gums or licking mints, right, that helps to reduce it. For some women, that excess salivation, there might be nothing you can do. It's just your body producing more saliva. So what they do is they get these small containers, right, that they spit in discreetly, like they just spit into it instead of spitting everywhere. Like they just spit into some small containers. And yeah, spit bowl and then empty it, at the end of the day. So some women just produce so much saliva that you can't keep it in. You just have to get it out. So one of the ways you can do it is discreetly get rid of it, right? Don't spit everywhere. Don't spit on people, spitting people's food. Yeah, it can turn people off. So you want to just be careful with that. And then another thing, maybe just move to, let me talk about frequent urination, because you also experience that in the first trimester, right? When you go anywhere, just before it's time to go to the toilet, try and locate where the toilet is, right? Like I said, when you're pregnant, toilet is your best friend. So anywhere you go, you want to make sure they have a toilet. Because if they don't have a toilet, you have no business being there, because you're definitely going to need a toilet. So always make sure you go to places that have a toilet. And when you go somewhere, know where the toilet is, so that when you have to go, you can, go on time. If you're going to go out, maybe on a long journey, long drive, avoid taking too much fluid so that you don't have to pee a lot, right? Just reduce your fluid that you're taking just for that journey, or let it be a journey that, you can have regular stops where you can use the toilet, because you are definitely going to need to use the toilet, right? Now, moving on to the second trimester, where your belly is getting bigger, right? As the weight of your baby increases, you start to feel back pain, right? Normally happens more in the third trimester, but some people start to experience it in the second trimester. So there's something called the pregnancy support band that you can get, that you wear on your bump, lower part of your bump and your waist. It helps to support with the weight of the baby so that you don't have too much pressure of the weight on your back, right? A lot of women say this helps to make them feel comfortable. It helps to ease the weight of carrying the baby. Then, when you're pregnant and your belly is bigger, you can no longer lie on your belly, unfortunately, for the next couple of weeks. So some women find that these pregnancy pillows helps to, help them sleep comfortably. So there are some of these lungs and come in all different weird shapes and sizes. Just get anyone that makes you comfortable, and just be comfortable sleeping on your side, right? Because for the most part of your pregnancy, you're gonna have to be sleeping on your side, right? And then, like I said, there's gonna be changes in your breasts. So your breasts are getting bigger. So be ready to change your bra for that time. Now, after you give birth and after you're done breastfeeding, for most women, the breast goes back to the normal size, or at least it goes a cup size lower than what it was in pregnancy, right? So just get ready that you're going to change your bras in pregnancy to make you feel more comfortable, right? But those bras might only be for temporary use. So you may not have to buy like too much because that's not your permanent size. It's still going to go back to normal, right? Or just a little bit slightly bigger than normal. So get ready to get things like a supportive bra to, carry the weight of the breast to make you feel comfortable and all that. Yeah. And then in the third trimester, like I said, when you stand for too long, you have back pain, swollen legs and all that. So try not to stand for too long. When you notice that you're standing for too long, because some women too, when they stand for too long, they start to feel dizzy, right? So you want to sit down sometimes, and then you also want to be stretching your legs when you're sitting down, doing leg exercises. And then for women that are dealing with swelling in the legs, right? Where possible, elevate your leg. So that means raise your leg, put it high up so that the fluid can flow back right to the heart. So those are some of the things that you can do to cope with the changes. Some other women come up with different coping mechanisms that are peculiar to them, but do whatever works for you to cope with the changes, right? As long as you're not harming yourself or the baby.
Thank you so much for that detailed explanation. Feels like you've taken us to an antenatal class. On WhatsApp, Rosemary says, I greet the doctor in the studio. When I was pregnant, I had cravings for hot foods. Everything must be hot. I had specialty for hot potatoes, hot toast bread, and hot rice. What I noticed was that I ate a lot of food. No throwing ups or morning sickness, just eating and sleeping. And I also had this craving for perceiving something related to dust or sand, just to smell it and I'll be all right. And I was very strong, agile, and jumping about till I gave birth. My baby came out at 3.0 kg. Well, congratulations, Rosemary. Then I have Habib from Surulere who says, good morning, Oluwaseun and Dr. O. Awesome program. I'm learning a lot. Thank you for the session. Please, I have two questions. So question one, if a woman is already a chubby person when she gets pregnant, will her body weight after during pregnancy, would she have any complications during pregnancy being a chubby person? And the second one is there a recommended weight size, 60, 70, 80 kg, etc., that a woman must be before she becomes pregnant? Thank you. So we have to be quick with the answers.
Okay. So in terms of being chubby causing complications in pregnancy, no. Your weight, so being obese or overweight may cause other complications or may predispose you to other things like maybe hypertension, right? But it doesn't cause complications in the actual birth process, right? So there's nothing like, oh, slimmer people have less complications, bigger people have more complications. So no, you don't have to worry about being big causing any problems for you in pregnancy or during childbirth, right? That's not relevant. Then the other one you said about what was the other question? Is there a particular weight you should be before pregnancy?
Yes, you should be before pregnancy.
So if you are not up to 50 kg, you cannot get pregnant. No. There's no such rule. However, it's recommended that you maintain a healthy weight at all times, right? You don't want to be underweight because you need to be your body has to have all the necessary nutrients to be able to carry that pregnancy, and your baby needs all these nutrients. So just make sure that you are maintaining a healthy weight, right? And also, when we talk about pregnancy weight gain, definitely when you get pregnant, you are going to add weight, right? And now this weight is not necessarily coming from added body fat. Right? Number one, the baby's weight is there. Number two, there is amniotic fluid. There is the weight of the placenta. And then there is what is called pregnancy weight gain, where you are just adding maybe one or two, a few kilos, right, with each trimester. Overall, what looks safe is somewhere around 6 to 7 kg. What is expected is somewhere around, expected to have at least a 6 to 7 kg weight gain during pregnancy, right? So if you're not gaining weight adequately during the pregnancy, your doctor might be worried because there may be a problem, right? Maybe the baby is not growing well, or you don't have enough amniotic fluid or something. So yes, don't be alarmed if you get on the scale and you notice that you are increasing in weight. It doesn't mean you're growing fat. It's just the baby inside you growing and the pregnancy changes that are causing the weight gain.
Thank you. Musty on WhatsApp says, the day I took pregnancy seriously was the day I read that every woman who goes through term and comes out okay has escaped madness. I'm paraphrasing it. I think there's a stat to it. That hit me. It's not easy housing and bringing out another being. Shout out to mothers. Prenatal depression, postnatal depression, this and that. Epele. Well, thank you, Muste. And thank you so much for your presence and detailed explanation. Very lucid thought, very educative. Thank you, Dr. O. We appreciate it. Now, for people to catch you on social media, your handles.
Yeah, so I'm actually available on most social media platforms. On Instagram, it's at Check with Dr. O. So that's Check with Doctor, the full spelling of Doctor, DOCTORO. On Facebook, it's just the word Check with Dr. O. On Twitter, it's Check with Dr. O. So the doctor is DRO, right? Not the full doctor. And yeah, I'm also available on YouTube, like I mentioned. My channel name is Check with Dr. O. So you can catch me on any of those social media platforms. And like I mentioned earlier, I have books, right? I write different books. What it's novels with health lessons in like embedded in the novels, and that's also available on Amazon and Okada Books in ebook copy or paperback if you like reading
Thank you.
novels.
And you can check the YouTube video right on our channel, which is youtube.com/smooth92 FM Lagos. On the other side will be more soul music because this is strictly soul. But before then, you will listen to about 3 songs talking about the woman and what she needs. Thank you so much. That was such